There are, I would say, three other agents that are far along in phase three trials. One to first mention would be Venetoclax, which obviously is a standard of care in elderly AML with hypomethylating agents. But actually, if we look even at real world data, and we've been part of this, both at frontline, both in prospective clinical trial, and our data show responses in up to 80% of patients. Again, these true complete remissions coming around 30%. Some of that's impacted by the cytopenia toxicities of the combinations, but clearly many more patients are responding. And really across molecular subgroups, people get response. I think the one caveat is this P53 mutant group. And although the response rates overall are not different, if you look at true complete remission rates, at least in one data presentation this past year, was about 17%, quite similar to single agent therapy, azacitidine. And if we extrapolate from AML, Venetoclax has not seemed to improve overall survival. So I think, again, response rates are higher. It looks really exciting for many MDS patients, maybe with the exception of P53 mutant. We utilize it both in frontline as well as salvage. So HMA failure patients were able to add on Venetoclax and get responses in about half of patients, especially for patients going to transplant. Those outcomes have been quite good. There's the Phase III VERONA trial, which again is the trial looking for MDS approval. One big distinction is the Venetoclax is only for 14 days. It also has a CR and OS endpoint, although potentially a little bit later before we get those first data readout. There's another Immuno-Oncology agent known as Sabatolimab, which is a TIM-3 inhibitor that is, again, undergoing multiple phase 3 trials in both the MDS AML setting, similar to sort of magrolimab design of some studies. The Stimulus trial is the phase 3 MDS trial that we're waiting on. And there's also a randomized phase 2 trial that we should have data in the not distant future for. But again, phase 1 data, a little bit smaller subsets of patients, but responses have not been that different. So I think that's maybe the one big negative. But if you look at the durations of response, particularly the durations of CR, they've actually been as long as like 19 to 20 months, which again, if that held up in large study would be, triple from what we may get with single agent azacitidine therapy. And thus we're quite encouraged by that. And then there's one sort of, I would say, molecularly targeted agent. This is the Syros compound that targets a PML-RARA that is undergoing a phase 3 trial with a primary endpoint of CR. If we look at what the percentage of patients that may have this overexpression, I think it's a little bit of an open question, and maybe 30 to 40%. I think at MDS, that's not completely clear. But again, it's an agent also in phase 3, maybe a little bit slower to accrue because, again, you have to have overexpression. And again, some of these other trials don't really require any testing, but I think it's another interesting concept. These are all what we're excited about for frontline, because really that's the major thing we're trying to change. I think salvage, again, Venetoclax does have some activity. There are some other agents like eldanexor, which has a breakthrough designation, is undergoing a larger study now in HMA failure MDS patients. And again, I think actually that's a huge clinical trial unmet need is patients once they fail HMA, what are we going to do for them is really a huge unmet need.